This segment is sponsored by iChiro Clinics. It is time to talk all things chiropractic care, and the guy to do that job is Dr. Michael Kwast from iChiro Clinics. Hi, Dr. Kwast.
Hey, how are you?
I am well, thank you. Thanks for taking a few minutes with us. Let's talk about chiropractic care. Folks who you see a lot of times tend to ignore their problems longer than they should, and then they become more complicated over time, right?
Yeah, we see that actually quite often. A lot of older people come in and they're kind of full of regret. They're saying they should have come in sooner. They wish they would have known what to do sooner. Because the longer you wait, it just gets more expensive. You have more pain and issues. You have more side effects from the treatments that are out there with medications, and your risk of having to do something dramatic go very high. So it's better to do things sooner than later. The problem is people don't really understand what chiropractic is and what the need for that is. So really somebody who has any mobility problem, they can't bend, move, twist or turn, or anyone who has any aches and pains, musculoskeletal aches and pains, shoulder pain, hip pain, neck pain, headaches, that type of stuff. Those are the things that when we get to those quick, then it's less expensive, less problems, better outcomes, better quality of life. And like, who doesn't want all that? It's just people don't understand.
So talk a little bit about that first visit, the assessment to find out sort of how you're going to attack the problem.
Yeah, the first step is always that evaluation to find where the cause of the problem is coming from, which most of the time that cause is going to be identified by the evaluations because they find any tight, stiff areas in the muscles and tissues that you have. And those tests then can be repeated later to see if there's improvement on those measurements, so we know if we're making gains or not. And when you can get the person's mobility better, they're never losing. No old person is regretting having better mobility. Like, better mobility is the key.
I know a lot of people too, from talking to you as much as I do over the years, a lot of people think I'll get in, I'll get a working over, and I'll be good to go. It takes time to right a problem that maybe has been festering for a long time.
Yeah, it's because it's muscle. So people want to kind of approach it like a spa, like I'm just going to go to the spa and I'll get my massage one time, or I'll get this thing done, chiropractic spa therapy. And that just never works for any kind of chronic problem because it's muscle. Just like I can't go to the gym for a spa treatment and work out once and then be like, oh, wow, where's my results? I mean, that's ridiculous. And doing it that way, it just doesn't work. And that's where people have bad outcomes because they're just not applying it correctly, understanding that it's muscle you're trying to change. When the muscle's working good, then the body will work better, and then you don't hurt and have problems, and you can move and do stuff. And that's quality of life right there.
As long as we're creating awareness around this, let's talk a little bit about sort of traditional chiropractic. There's a lot of technology that has changed the way that you deliver help to people. You can still do the cracking and the twisting, right? But you don't have to in order to help people find relief.
Yeah, there's so many things, just technology, like anything, like just us sitting here talking on Zoom right now, where I used to have to drive into the studio, right? Technology's changed everything, and we have computers that can actually stimulate those deep muscles, get them to relax, get the mobility back, measure it all, so that people who don't want to be wrestled around or don't like that, they don't have to do that. We have so many solutions. There's really no excuse anymore, other than people are just ignorant about what their options are, because really what we're doing is we're restoring people's mobility and function so that they can move better, so they have a better quality of life. And who has an objection to that? That is just called like common sense.
Yeah.
So it's just trying to get this understanding out there, which is why we're talking.
Yeah, for sure. Real quick, do they have to have a referral from their physician?
No, so you do not need a referral from a physician. Most of the insurance companies out there do help people on some level. None of them covering everything you're going to need, but they do help out, and we participate with virtually all of the insurance companies.
Awesome. Okay, folks, iChiroClinics.com. You can make your appointment right there. iChiroClinics.com. Dr. Kwast, thank you.
Thank you.